High blood sugar symptoms, diabetes and complications of hyperglycemia. The high blood sugar, also known as hyperglycemia, refers to elevated levels of glucose in the blood. It is the most common problem with diabetes, but it can affect non-diabetics in certain circumstances as well. Glucose is the body's main source of energy and comes primarily from carbohydrates in food. The hormone insulin, produced by the pancreas, helps cells absorb glucose from the blood and regulate blood sugar levels. When this process is disrupted or impaired, high blood sugar levels result, which can cause both short-term discomfort and long-term health consequences. If left untreated or poorly managed, high blood sugar levels can lead to a variety of complications, especially for people with diabetes. High blood sugar can be caused by a variety of factors, the most common of which is diabetes. Symptoms of high blood sugar. While mild high blood sugar levels may not produce noticeable symptoms, more severe cases can cause discomfort and, if left untreated, can lead to serious health complications. Common symptoms of high blood sugar include frequent urination, also known as polyuria. Increased urine output occurs as the kidneys try to remove excess glucose from the blood. This is one of the hallmark symptoms of high blood sugar and is particularly noticeable at night. Increased thirst. In addition to frequent urination, high blood sugar levels can also lead to dehydration. As the kidneys work to eliminate the extra glucose, the body loses water, causing increased thirst. Blurred vision. Elevated blood sugar can cause the lens of the eye to swell, which can cause temporary changes in vision. Over time, poor blood sugar control can lead to more serious eye problems, including diabetic retinopathy. Fatigue. High blood sugar levels can make it difficult for the body's cells to absorb glucose for energy, leading to feelings of fatigue or exhaustion. This can occur even if the individual is getting enough sleep. Headaches. Persistently high blood sugar levels can cause headaches, which may become more frequent or severe as blood sugar rises. Difficulty concentrating. High blood sugar levels can impair cognitive function, making it difficult to concentrate or think clearly. This is sometimes called brain fog, and can be an early indicator of elevated blood sugar. In severe cases, untreated high blood sugar levels can lead to diabetic ketoacidosis in type 1 diabetes or hyperosmolar hyperglycemic state in type 2 diabetes. Both conditions are medical emergencies that require immediate treatment. Diabetes is a chronic disease characterized by the body's inability to regulate blood sugar levels effectively. It is divided into two main types. Type 1 diabetes. In this type of diabetes, the immune system mistakenly attacks the insulin-producing beta cells in the pancreas. As a result, the body produces very little insulin and cannot regulate blood sugar without external insulin. Type 1 diabetes usually develops during childhood or adolescence, but can also occur in adults. Type 2 diabetes is more common and occurs when the body becomes resistant to insulin, meaning it cannot use it effectively. Over time, the pancreas may also produce less insulin. This type of diabetes is often associated with obesity, lack of exercise, and a poor diet. While traditionally diagnosed in older adults, it is becoming more common in younger people due to increasing obesity rates and sedentary lifestyles. Diet plays an important role in regulating blood sugar levels. Consuming large amounts of sugary foods, refined carbohydrates, and sugary drinks can cause blood sugar levels to spike quickly, especially in people whose insulin function is already impaired. Foods such as white bread, pasta, pastries, and sweetened drinks can cause blood sugar levels to spike because they are quickly broken down into glucose. On the other hand, a balanced diet rich in whole grains, lean protein, healthy fats, and fiber can help stabilize blood sugar levels and promote better blood sugar control. For people with diabetes or prediabetes, understanding how different foods affect their blood sugar levels is essential to managing the condition. Regular physical activity helps the body use glucose more efficiently. Exercise promotes insulin sensitivity, which means that the body's cells are more responsive to insulin and better able to absorb glucose from the blood. Lack of physical activity, especially when combined with a poor diet, can lead to insulin resistance and cause blood sugar levels to rise over time. A sedentary lifestyle increases the risk of type 2 diabetes and makes it more difficult for people already diagnosed with diabetes to control blood sugar levels. Both physical and emotional stress can cause blood sugar levels to rise. When the body is stressed, it releases hormones such as cortisol and adrenaline, which prompt the liver to release glucose into the blood for extra energy. This is a natural response to stress, but can be problematic for people with diabetes or who are at risk for high blood sugar. Infection or illness can also cause blood sugar levels to rise temporarily. When the body fights an infection, it releases stress hormones that interfere with insulin's ability to regulate blood sugar. Conditions like the flu, a cold, or a more serious infection can cause high blood sugar levels, even in people who don't have diabetes. Certain medications, especially steroids, can cause blood sugar levels to rise. These medications are often used to treat inflammation, asthma, or autoimmune disorders, but they can interfere with the body's ability to use insulin effectively. Continued high blood sugar levels can lead to a range of long-term health complications. These complications are often associated with uncontrolled diabetes and can affect various parts of the body, leading to serious health problems. One of the most significant long-term risks of high blood sugar is the development of cardiovascular disease. High blood sugar can damage blood vessels and cause plaque to build up in the arteries, increasing the risk of heart attack, stroke, and other cardiovascular problems. People with diabetes are at a much higher risk of heart disease than non-diabetics. Long-term exposure to high blood sugar can lead to diabetic neuropathy, a type of nerve damage that primarily affects the legs and feet. Neuropathy can cause pain, tingling, numbness, or weakness in the affected areas. In severe cases, nerve damage can lead to a loss of sensation, making injuries or infections in the feet difficult to detect, leading to serious complications. The kidneys play a vital role in filtering waste from the blood. Over time, high blood sugar levels can damage the tiny blood vessels in the kidneys, impairing their ability to function properly. This disease, called diabetic nephropathy, can progress to kidney failure if left untreated. In severe cases, dialysis or a kidney transplant may be necessary. High blood sugar levels can damage blood vessels in the retina, the part of the eye responsible for vision. Diabetic retinopathy can lead to vision loss and, if left untreated, blindness. Regular eye exams and good blood sugar control are essential to preventing and managing this disease. Nerve damage and poor circulation caused by high blood sugar levels can lead to serious foot problems. Small cuts or blisters can become infected and may not heal properly, increasing the risk of ulcers and, in severe cases, requiring amputation. People with high blood sugar levels are more susceptible to bacterial and fungal skin infections. Conditions such as diabetic skin disease, fungal infections, and slow-healing ulcers are more common in people with diabetes.